welcome everyone. Hope you are enjoying this conference and welcome to the afternoon keynote talk, Investing in Healthcare for an Equitable Future. And as you all know, good health is a fundamental human right and a pillar of economic opportunity. And this is coming from United Nations, actually. And and it is my pleasure to be in a fireside chat with Dr. John Mattison. Hello, John.
Hey, good to be here. Good to see
Yeah,
you.
likewise, John. Yeah. So always great seeing you. Actually, yeah. Then John was supposed to be here in person today, but due to some unforeseen situations, due to pouring rain, I think the plans change, and we are so John. We decided to have John zoom in actually and present this amazing fireside chat to you, and which will focus on how to accelerate our progress towards achieving UN's Sustainability Development Goal 3, actually, which is also called Good Health and Well-being Goal, actually. And the mandate is by 2030, John, actually. So they put it in. It was postulated on 2015, and it proposed that to achieve that goal by 2030. So and also, John and I will discuss and share our perspectives on factors to consider when investing in healthcare for an equitable future. And John, that Elon Musk has recently, committed to donate $6 billion towards ending world hunger, right? So I think and you and I are coming from both scientific backgrounds, hospital, healthcare, as well as from the investment backgrounds, right? Actually, so given if the money is not an issue, how do we achieve this goal, actually? So so I think looking forward to your views on that. But first of all, I would introduce you. So John is a friend, and a long-term collaborator, partner, and he's also now assumed a new responsibility as a partner at Arsenal Capital Partners, and he's also former chief medical information officer and as well as assistant medical director at Kaiser Permanente, where he led a digital health initiative, which was very successful. He focuses on transforming care delivery with information technology, IT, through the convergence of exponential technologies and data liquidity. And John has, towards his credit, designing and implementing the largest integration of EHR, electronic health records, in the US. And he has led various national programs, including virtual care, actually. So I think, John, welcome. And with that, I think I would like to ask you, if money is not an issue, John, what would you think can be done to basically conquer the world health problems?
Yeah, as many others have suggested before us today, the digitalization of the world has led to a dematerialization and a democratization of technology. And with the advent of the internet, which is a global access to information, with the exception of totalitarian regimes, we can accelerate democratization of all new technologies across the globe. Vint Cerf, who's recognized as one of the founders of the internet, having invented TCP/IP, has over 10 years ago started a group called the People-Centered Internet to look at how do we use the internet in ways that maximize the benefits of the internet and minimizes the harms that have emerged during the infancy and now the adolescence of the internet. And one of the things I like to think about in terms of globalizing equitable healthcare is that physicians, nurses, all of the people in the healthcare enterprise go into medicine because they want to make the world a better place. And many of them get frustrated. Many of them now are burned out because it's so difficult to practice the altruism that led them into the system, because the system is so complex and convoluted and regulated. But there are many, many nurses, physicians, pharmacists around the world who are more than interested in helping others within and outside the boundaries of their own countries. And we certainly have health equity issues within the US, but there are those who are seeking to extend their compassion and altruism on a global scale. With the advent of remote monitoring, with all the sensors, virtual care, and artificial intelligence, we can maintain a fairly high level of quality and quality assurance and quality improvement using these digital tools at a global scale. And so this notion of democratization of technology is really quite tangible and is getting traction around the world as we speak. It's still very early, but my expectation, and I really firmly believe in this, is that there's a very bright future of bringing equitable healthcare, just like the cell phone leapfrogged the wired telephone lines. Digital health is going to leapfrog physical bricks and mortar kinds of healthcare in many ways. And the more we see the advent of artificial intelligence, and just to give one example, there are AI companies that not only use AI to interpret the images coming out of a portable, small, inexpensive, democratized ultrasonic device that could be taken anywhere in the most rural, poorest communities, but there's also an AI that helps the operator know exactly how to use that technology real time. So there's a lot of operator error and operator variations in the use of ultrasound. I'm using this just as an exemplar of exactly how democratized the future can be and how much equity there can be, so that we can have world-class operation of ultrasound, world-class interpretation of ultrasound, with nobody but the individual patient or a family member operating a inexpensive device in remote areas that may not have the resources to build the bricks and mortar kind of services. So this is very real. This is not hypothetical. This is very real. It's happening before our very eyes. And we need to scale that. We need to train people. And one of the most important things around harvesting this altruism is as the old axiom implies, to paraphrase it, give a woman a fish and she can eat for a day. Teach a woman how to fish and she can eat for a lifetime. And so to the extent that we use the same global infrastructure and digitization and democratization of technology to train people locally how to better provide public health service, how to better provide care delivery, how to support people using these tools and sensors remotely, how to integrate digital health with conventional bricks and mortar kind of healthcare. That kind of opportunity for global teaching will take us away from the lack of equity in healthcare by virtue of overcoming the lack of equity in education. So if there are two verticals globally that are recognized as being systematically broken, healthcare and education rise right up to the very top as one and two. And yet we are embracing an opportunity to overcome both of those. And I would say that the higher imperative is education, because that spans not just healthcare, but all other aspects of the human experience, but to use that as an accelerant to bringing more self-sufficiency and to encourage more entrepreneurship across the world, so that the innovation and the application of that innovation becomes more self-sustaining and more of a global phenomenon, rather than a charitable act from more developed nations to less developed nations, more entrepreneurial nations to less entrepreneurial nations. Tackling that issue pays dividends, not just in healthcare, but across that entire human experience. So I'm very optimistic that the current lack of health equity that has been so revealed and so amplified in the current COVID pandemic that we're in is a very tractable problem. And probably the biggest impediment to moving this forward is a lack of imagination and a lack of confidence and a lack of vision in the political leadership across the global landscape to embrace these opportunities and really bring about the true democratization that comes with the digitalization and the advanced democratization of technologies in healthcare and education.
Yeah, no, that's and well said, John. I think so. I lead American Association for Precision Medicine, and before the pandemic hit, actually, we would foresee that, and we created AAPM Coronavirus Task Force, and we abbreviated as ACT, and ACT has done. We helped first China. When things got bad in U.S., we were helping all the hospitals and healthcare systems in U.S. And recently, what happened in India, collectively we created a consortium, and together what we did is we connected physicians in India with physicians in US actually, and there were a lot of physicians. They came together. They wanted to make a difference actually. So then we facilitated those conversations, and it is just amazing how this all came together. We worked with governments. We worked with who's who in the in the sector, and all shipping companies, nonprofits. They all came together and seamlessly provide this promise of the digitized world, actually digital health, actually, or digital transformation. And this happened, and for me it was truly humbling to see, actually. So so the question to you would be, is the future of the healthcare is now going to be decentralized from the existing hospital model? John, do you think we are going back to old ages where a physician will come to see you, or you see you through virtual means? Actually, would what I'm trying to say, that would the hospital model will be obsolete, or we still be doing the necessary surgeries and other necessary visits in the hospital, and we'll have a hybrid model? Any insights on that?
I love that question. Right before COVID started, I spent 2 weeks in rural India actually looking at opportunities for virtual healthcare and bringing that into the rural communities in the Lucknow province of India.
Mm-hmm.
And as you're well aware, outside of major cities, rural healthcare in many parts of the world, including India, is pretty close to non-existent.
Mm-hmm.
And so in speaking with hundreds of people in villages across the rural Lucknow region, it became apparent that they were very anxious for having this kind of support. They were hyper aware of the fact that they suffered from a lack of health equity. And so the answer to the bricks and mortar question of hospitals, I actually asked one of the local politicians, how many ambulances they had. They had one ambulance for 3 million people. And I said, how do you decide when to send it? And the answer was that a high percentage of people who were put in an ambulance to go to a hospital 70 miles away never made it there alive. So that is a situation ripe for reform. So do we need to have hospital-centric healthcare? I think the answer to that question is I would actually change the question a little bit to say, what is the role of hospitals in the future? And I think they should not be the center of healthcare, because hospitals really represent the failure of healthy lifestyles. They represent the failure of healthy preventative medicine. They represent the failure of safety in engineering, so that trauma, whether in farming accidents in rural locations or automobile accidents, that the hospitals really capture the failure of health promotion. So if we view digital healthcare and democratized healthcare and equitable healthcare as first and foremost a way to bring healthy lifestyles and healthy education and preventive medicine, personalized preventive medicine at scale to underserved communities and rural communities, then the role of the hospital diminishes in a really valuable way in terms of the overall public health of the community, and in terms of the economic health of the community, not having to suffer from the ravages of bad choices in lifestyle decisions and in those aspects of preventive medicine that are just not available to those communities. So to the extent that we don't just do the hospital at home notion of waiting until people get really sick and then putting a ventilator in their house. That's not the ideal goal. That is something that is very helpful, but at the center of the healthcare system of the future and equitable healthcare is not the hospital at home. The center of it is health maintenance, health and preventative screening and health measures and early detection and early treatment. So digital health is agnostic in terms of whether it's used for treating diabetes, obesity, heart disease, cancer, dementia, versus preventing all those diseases. So why not focus more on early education and early prevention, starting early in life, so that we can help people develop healthy habits? And that's where the intersection of democratization of education and democratization of healthcare really go together. So if we're going to tackle these health equity issues, there's a tremendous interconnection between the digital future, education, and healthcare. And we need to make sure that we don't just try and replicate high intensity healthcare for failure of teaching people healthy lifestyles and preventive medicine.
Yeah, wonderful. Totally agree, John. So I think, on your ambulance remark, I think we had an experience like so it just basically how human beings are working collectively. So there were couple of taxi driver organizations, taxi drivers, the organizations, and rickshaw drivers, actually. And this happened in India. They acquired, a donated, oxygen cylinders and masks, and then they filled the void of, ambulances, actually. So they took people, to hospitals, actually, and this saved many lives. So this is a little pivot, actually. You see it to the traditional ambulance model, how folks themselves were able to make a difference. And totally agree with you. So I think, one of the focus is universal health coverage, John. I think it means, that everybody, now we are talking about inequity, now we have folks who can afford the care, they can, get the care, but then there's a, huge population in the world, actually, and which is approximately some 5 billion people are at risk of missing out healthcare in 2030, actually, and I think pandemic has even worsened this, actually. What are the different ways we can adopt to reduce this inequality, John, actually?
Yeah, I think your reference to the rickshaws in India is very insightful, because much of what's happened in the past with the more developed countries trying to help the less developed countries is to bring a model of care that made sense in the developed countries, but may not transfer well into other cultures, into other environments, into rural settings. And so I love the fact that you brought up the rickshaw solution to ambulance care, because we need to be very sensitive to those local variations in resources, those local variations in attitudes, those local variations in culture, those local variations in governance, and make sure that we don't do what has been observed in attempts to, for example, combat malaria in Africa. Mm-hmm. Solutions dreamed up by brilliant people in developing countries and just sort of thrown at a problem that without first understanding what are the priorities of the local communities. Is it teenage pregnancy? Is it drug addiction? Is it absenteeism from schools? What are the goals and initiatives that are of the highest priority to those local indigenous communities and governance structures? And we need to really respect them and adapt what we do to the local circumstances. And the best way to do that is to train and engage the local people to make those decisions for themselves and develop their own autonomy about how they use these systems, and not be dependent upon someone else telling them how to achieve higher levels of health. So I love your reference to the rickshaw. It's just iconic of how much we need to be respectful of local conditions, to be sensitive and empathic to those, and to primarily try and support those local communities in their own aspirations, in their own priorities, rather than bringing ours and just trying to do an overlay on them based on our experience in an entirely different cultural and economic context.
Yep. Yeah. And I think overall, collectively, what you're suggesting that if we utilize those local resources, then we will basically reduce the, cost, that goes into, healthcare costs. And then we will dramatically, locally, will be able to bring the costs down, actually. And that's how the local, hospitals and healthcare systems in Africa, India, and rural China, they have operated so I think there's something works at in a developed world and something works at the, in developing countries, and I think we have to be cognizant of that, actually.
And the other thing I'd like to say just real quickly is that we have a lack of trust in large institutions that is a global phenomenon, and the best way to really acquire the level of trust needed to develop these kinds of equitable solutions depends heavily on our listening and understanding that local context. And absent that trust, just coming in with that template, absent the trust that the community knows that we care about solving the problems, not just how we see them, but how they see them, how they experience them, and the solutions also conforming to those values and expectations, the more we can overcome the inequities that we see all around the globe.
Wonderful. Yeah, very well said, John. And also you mentioned about technology, John, right? How do you think that, can we, collaborate and co-innovate and, freely share data, actually? This is a healthcare data. So, I know you have been part of the, several consortiums, where, they have tackled data silo issues. We have also AAPM led a data, in AAPM Innovation Center, where we have created this consortium where stakeholders share data and AAPM monitors the IP, actually. So this is would you like to, share some of the experiences, actually, John, how we can, change the traditional, innovation model?
Yeah, well, I think when we talk about data, and the data has been described as the new oil. And it is not just the new oil for the economy, it's the new oil for health. And to the extent that we use modern technologies like distributed ledger technology, like homomorphic encryption and its colleagues in the tech space, we will be able to share data at much, much lower risk of risking the privacy of individuals. And to the extent that we build models, and there are many initiatives around the globe right now for better data sharing, for better advances in not just research, but in the application of healthcare therapies and in interventions that rely on being able to share data without violating privacy. So there is an emergent solution set that is being built out by many entrepreneurs and large corporations alike, that will help us address these issues of how do we protect privacy at the same time that we harvest the data in ways that benefit the entire population. So in the past, these have been pitted against each other as mutually exclusive, high security versus high privacy. There are some emerging technologies that really allow us to break down that historical dichotomy between privacy and global sharing of data. So I'm very optimistic on that front too.
Mm-hmm. Yeah, that's amazing, John. And then, I think we are coming, right at time. So one last, question to you would be, so, what my motivation has been to basically solve the inequality issue. And we have, brought together world's, biggest investors, actually, VCs, private equity. We have also brought together the angel groups actually. In fact, we are all going to meet in January 8 to 13 at WISE actually in San Francisco as well as virtually, and I invite you all to be part of that. And this agenda will be there. So the goal is collectively, if we can if we can collect the money, John, actually. So if I give you suppose $6 to $10 billion actually. So what are the 5 to 6 steps that come to your mind, to just run with it, and then we can, to basically address this issue worldwide.
Yeah, I think that money always helps. If that money is channeled in ways that are targeted at creating more and more self-sufficiency, I think we'll see this initiative grow exponentially. If it's taken as one-time gifting of tools and devices and infrastructure, that's helpful, but it's not sustainable. So we need to think about this in terms of sustainability and really putting at the top of our value hierarchy, how do we create health equity and autonomy and self-sustainability? I think we can leverage that money, because $6 billion on a global scale is not a lot of money. It sounds like a lot of money, but on a global scale, it's not. So how do we deploy that in ways that create more entrepreneurship, higher levels of education, higher levels of autonomy, so that the advances are sustainable?
Yeah, I think you said the key: entrepreneurship, John. Entrepreneurship and innovation.
Absolutely.
Actually, yeah, I think that's what our goal is. And ZGC and Global Health Impact Fund, they're present here. Actually, they're partners in our WISE initiative. So I invite you all to come together and and join and see how we can together change the world and lay the foundations of the new world that would be that our coming generations will thank us for. So thank you, John, for taking your time. I know there's a lot going on at your end, but thank you for taking your time.
Thank you for all you do, and let's make this world a better place together.
Likewise. Thank you, John. Yeah. Thank you very much. Yeah. Take care. Bye.